Hey everyone, I'm responding to our Module 3 prompt. I am here to talk to you about leadership skills and the context in which we are trained to use them. So we got to do an experience where we kind of looked at the organization of our own, the organizational structure of our own institution. We got to do the leadership questionnaire. Read a few chapters in our book and also find an article that was relevant. So I want to talk about all of those. The leadership skills questionnaire was not a surprise for me. I was not surprised to find that interpersonal skills was my strongest suit. That's why I became a nurse. That's what I'm good at. I feel like it could have its pitfalls in management because even though it's great to be able to read people, you can't always be everyone's friend. Morality is great, or morale is excellent, but you can't always make everyone happy. You have to make tough calls in management. And I'm not sure that my interpersonal skills would translate well to that. My lowest category, even though it wasn't low, my lowest category was administrative skills, which I feel like might be more a reflection of the fact that I've only been a nurse for 2 years. As opposed to any true deficit. I don't think it's like an innate ability I have. I think that it's something that would have to come with time. So what that means for me within the organization that I work in. So it's important first to understand that I work in a really big hospital system. I work in one of the largest hospital systems in the United States. I think the largest one in the Southeast United States. And within that, I work in the largest hospital in that gigantic organization. So there is a lot of vertical or tall organizational structure there. There is, once you get above a certain level, kind of a division level, it's kind of straight up and down. Luckily, kind of the interaction that I have is primarily with that more horizontal level. So we have at my hospital certain divisions. I work in a surgical trauma ICU. It's a 29-bed unit. And we fall within 2 different divisions. So we fall within a critical care division, and we also fall within the surgical division. So luckily that only leaves us one administrator to report to, who then reports to the administrators of the administrators. But my nurse manager has to be able to work within what are the needs of the surgical division as well as what are the needs of the critical care division. It's especially important when it comes to staffing because only ICU nurses can float to ICU nurse or to ICU floors. So even though as a greater hospital we function in a vertical way and we have that horizontal framework in the division level, in our bedside practice, we absolutely use a matrix model. We work in an interdisciplinary framework with usually about 12 people rounding. Our TICU, or trauma ICU rounds, usually have about 12 people. Various physicians. We have respiratory therapy, registered dietitians. We have our speech pathologists sometimes, our clinical case managers, the nurse, attending physicians, residents. So there's a lot of different perspectives coming together to make choices. And I function very well in that kind of matrix model where everyone comes together to take care of one goal. I think that with my skill set, I would really struggle to be like a nurse manager because you're not only having to balance the needs of your patients and your staff, but also the needs of the hospital and the division. You know, you're having to come down and say, I know it sounds, we had an instance where in order to meet our quality indicators, we have to be compliant with giving pneumonia vaccines. Well, a nurse charted that against giving a pneumonia vaccine to a woman who was nearing end of life, who we were withdrawing care on, and my nurse manager had to come back and tell us, that's not okay. That's not an excuse. Under the current quality indicator, you still have to give a pneumonia vaccine to an actively dying patient. That's really hard to balance both the needs of the patient, the staff who feels morally distressed at that idea, And of course, like the needs of the hospital. What are they being reimbursed for? What certifications might they lose if they don't give out all these vaccinations that they need to give out? Um, I think that our book discusses a bunch of different skills that are needed in order to be a nurse manager. And I thought the most compelling combination to me was the idea of coordinating and directing. For some reason, those two felt like two sides of the same coin. Coordinating to me sounds so much more like horizontal in nature and so much more interpersonal. It's, finding people's strengths and applying them to jobs that are, suited to their talents. Whereas I feel like directing is, I need this. I need you to rise to the occasion and do this. I need you to provide that. And I feel like that assertiveness, that directing, I feel like that's what's really needed to be a productive nurse manager. And I do not have that right now as a baby nurse of 2 years. But I think that it's that strengthening, that delegation is definitely like a goal of mine. So when I was looking at all of the literature that's online, I actually ended up pulling what I think was the same article as a lot of different people because it was really interesting. And it's The Resistance to Change in the Nursing Profession, Creative Transdisciplinary Solutions. And the article, I chose it, even though I had read others, I chose this one because it, because it says in the second paragraph that transdisciplinarity is not the same as multidisciplinarity, which I feel like our prompt kind of gave us some leeway and said, well, you can talk about interdisciplinary and you can talk about transdisciplinary and interpersonal. This says, no, they're not the same thing. So what Clark is advocating for in her article is shrugging off our paradigms altogether. Whereas interdisciplinary or multidisciplinary, as she describes it, allows for everyone to maintain their paradigm but come together and interact. I don't think it's possible, frankly, for people to completely abandon their paradigm. I don't think that you can get physicians to stop thinking like physicians or accountants to stop acting like accountants, but I think that the more dialogue and interaction you have with those two fields, I know that I'm more comfortable making sacrifices with resources as a bedside nurse if I understand the financial strain that it's causing my division. If I know that by having less expensive chuck pads, we can afford to keep another nurse. That I feel like that's the type of communication that's possible through the horizontal model. So when I look at what I have a preference for as far as horizontal versus vertical framework, I definitely have a preference towards the horizontal framework because as our textbook says, just as Graham Murray said, in the vertical framework, communication, however, may be distorted because the message, even if written, is sent through the various layers of the organization in a long line. Unquote, page 133. I think that the distortion of communication is where a lot of things go wrong in leadership and management. And I think it's very useful to understand the paradigm that is limited, that a paradigm is limited if not used in an interdisciplinary sense. So I think that's it. Thank you so much.